December 23rd, approximately 2,000 new cases of COVID-19 were identified and about 11,500 tests were completed. On December 24th, approximately 2,500 new cases were identified and about 11,500 tests were completed. On December 25th, around 1,600 new cases were identified out of 7,200 tests. On December 26th, we had approximately 750 new cases out of about 4,000 tests. And yesterday, as you heard, we had approximately 1,400 new cases identified out of 6,500 tests. Our positivity rate over the past 5 days has ranged from around 17% to 22%. And as you heard earlier, we have never before had a higher positivity rate than just over 13% in any of our previous waves. This is one more data point that reinforces that Omicron is different from anything we have ever faced before. In Calgary and Edmonton, about 1 out of every 3 people going for tests is testing positive. That is why anyone who feels ill at this point should stay home and away from others until they're feeling better. We know from previous waves that our PCR testing program was capturing about 1 in 4 of the actual cases based on our serial serology sampling that we do. That increased, or I should say the proportion changed slightly, and in the 4th wave, we anticipate that we were catching about 1 in 6 of our actual cases with our PCR testing program. Again, there are many people who for various reasons don't seek testing when they're sick. And with the shift to making rapid tests available, I would anticipate that the PCR tests that we are currently reporting as positive, again, are just the tip of the iceberg, and it would be expected that the total number of people who actually have Omicron would be much greater than is currently captured in our numbers, again, because we're going from that baseline of about 1 in 6 previously, and it would be a smaller proportion we're capturing in PCR with this change to use rapid tests, as other provinces have done, to be able to manage the significant surge and focus our testing capacity on those who need that PCR test to either manage their clinical care or help to manage outbreaks in high-risk settings.
I will take seriously any future advice that we get from our public health advisors, as well as the people responsible for administering the hospitals. Right now, that kind of protocol that Quebec has gone to is not necessary in Alberta, but I don't think we can completely rule out that if our hospitals were under the most extreme kind of pressure, that we would have to modify the self-isolation requirements to maximize the workforce. But that is not something that's under active consideration with respect to people who are currently infected in Alberta in the healthcare workforce. So we have a 10-day isolation requirement. That is the rule that we have right now. If somebody tests positive or is infectious and they have been vaccinated, and by the way, I think 97% of the AHS workforce is vaccinated, then they have to observe the 10-day isolation requirement. That's the current policy. If there's any change, we'll of course let you know. This has been another long and hard year for everyone. In one way or another, COVID-19 has touched the lives of every Albertan, just like everyone around the world. And that's why it is up to each one of us to do our part to help stave off the potential worst consequences of this 5th wave. And on this, I know people are seeing encouraging early data that the Omicron variant is significantly less severe than earlier variants of COVID. But we also know that it is hugely transmissible. We are seeing and experiencing that in Alberta right now. And so if the numbers reach an unmanageable high, even a very small percentage of those people requiring hospitalization could be enough to challenge or overwhelm our healthcare system. So please take this very seriously. I hear a lot of people just dismissing this as the common cold. It is nothing like that in terms of its severity, and certainly not its transmissibility. Please take this very seriously.